of the Emergency Operations Center, as unfortunately we'll also be talking about a potential storm that we are looking at. So with that, Mayor Gimenez, go ahead with your message of the day. Good afternoon.
Thank you. I'm not a doctor, but I do play one on TV. So good afternoon, everybody. I have been very encouraged by the declining daily positivity rate and the steadily falling numbers of hospitalizations from COVID-19. It's a great sign. It's thanks to all the residents who have been following the new normal guidelines, wearing face masks whenever in public, and always practicing social distancing. It's also due to stepped up enforcement throughout our county and our countywide 10 p.m. curfew, which is helping to curtail house parties. I also want to thank certain cities which are really stepping it up on enforcement, particularly the city of Miami. I want to thank them for their efforts. But we haven't reached the ideal point to open up more businesses just yet. And believe me, I'm the first one who wants to get our economy moving again. If we start to open before the conditions are right, we can end up with our hospitals getting overwhelmed and more lives will be lost. We will be forced to go back and close again, and that's really not an option that I want to explore. The good news is that we're heading in the right direction, and if our entire community continues to follow the public health rules, we can beat this thing and reopen up our businesses and our public schools safely in a matter of weeks. It doesn't mean a full-fledged opening. That will have to wait until we have a vaccine, and it doesn't mean opening with people no longer wearing masks or businesses no longer having capacity limits. All those safety measures have to remain in place in our new normal. Wearing masks, social distancing, washing your hands often, taking care to protect your family members who may be at higher risk of catching the virus. These are all the things we must continue to do even as we reopen. I also want to stress how much I appreciate the state's support and flexibility and approaches we have taken to protect residents during this pandemic. I agree with Governor DeSantis that we must continue to work collaboratively with a bottom-up approach as South Florida considers more reopenings based on each county's local conditions. Yesterday, Miami Mayor Francis Suarez and I had a conference call with several doctors from the CDC, including Dr. Deborah Birx, to get their input. They are very pleased by what the county is doing to reduce the spread. In fact, Dr. Birx told us that the White House medical experts have been sharing with other communities throughout the nation Miami-Dade's strategy to stop the spread in multi-generational households. So we are a model, and that's the key. We all need to act as if we're carrying the virus. It's clear from the contact tracing that the Florida Department of Health has been doing in our county that household spread continues to be the biggest culprit. It's most important to stress again to our younger residents that you must take special care around those in your home who are at high risk. You might be carrying the virus and not know it, so keep your distance from them and keep your masks on around them. My senior staff and I met yesterday with our local medical experts, and many of those distinguished doctors are joining me here today and will be available to answer your questions. They all agree that we have to be cautious as we head into the Labor Day weekend, which is only 2 weeks away. Also, we're heading into flu season, so it's very important that everyone get their shots because it will help tamp down on people going to the hospital with the flu in the middle of a pandemic. We know from experience that we have COVID-19 spikes in hospitalizations after holidays, such as Easter and Passover, and most recently after Memorial Day. Please don't have parties or family gatherings. I know I can sound like a broken record here, but that's what we must do and continue to do so for the time being to get our economy back on track and do it as safely as possible. This virus has no respect for boundaries, which is why we continue to meet with our counterparts in Broward, Monroe, and Palm Beach counties to share strategies. We're working together so that we don't backtrack on all the progress that we have made, especially as several private schools and universities are now opening up in our region. I want to ask all of the leaders of these academic institutions to keep your guard up and enforce the public health rules on your campuses. I realize the value of having students back on campus, so the success of these institutions will bode well for more reopenings in the near future. To that end, I will be meeting with our restaurants group and other businesses next week to start planning for a reopening when the conditions are right to reopen safely and keep it that way. All that we're doing is guided by the public health experts and the best practices that we know that work. And now I have a brief update about Tropical Storm Laura. We have the potential for heavy rains and tropical storm winds across South Florida by Monday. We will keep you updated. So by now, everyone should be prepared. We already ran through the drill a few weeks ago with Hurricane Isaias. We were spared, but please don't get complacent. Pull out the county's Hurricane Readiness Guide you received in the mail earlier this year. Have a clear plan and check if you live in an evacuation zone. You can download the guide at miamidade.gov/hurricane. Have food and containers of water on hand for at least 3 days. Charge your cell phones in advance. Make sure you have batteries and clean up debris in your yard. We also have a free app called Ready Miami-Dade that everyone should already have on their smartphones. You can also sign up for Miami-Dade alerts at miamidade.gov. Now I'll do an update in Spanish before taking your questions. Buenas tardes a todos. Me complace ver la reducción en la tasa de infección de COVID-19 en Miami-Dade. Además, el número de personas en el hospital sigue bajando. Esto está pasando gracias a todos los residentes que han hecho lo correcto, usando máscaras cuando salen en público y siempre practicando la distancia social. Es importante que sepan que no hemos llegado al punto donde podemos abrir más negocios. Créame, yo soy el primero que quiere impulsar nuestra economía otra vez, pero si abrimos antes del momento indicado, podemos terminar perdiendo más vidas y con hospitales llenos una otra vez. En ese caso, tuviéramos que volver a cerrar todo de nuevo. Esa opción es algo que yo no quiero. La buena noticia es que vamos en el rumbo correcto. Si seguimos tomando las precauciones de salud, podemos ganarle al virus y volver a abrir negocios y escuelas en cuestión de semanas. Esto no significa que vamos a abrir como antes de la pandemia, pero por eso necesitamos una vacuna. Tampoco significa que las personas pueden salir sin máscaras en público o abrir los negocios con capacidad que tenían antes de la pandemia. Tenemos que continuar haciendo estas cosas para reabrir más negocios. Estoy agradecido por el apoyo del estado de la Florida que nos has dado durante la pandemia. Estoy de acuerdo con el gobernador DeSantis. Debemos seguir cooperando y tomando decisiones para la reapertura basada en las condiciones únicas de cada condado. Ayer el alcalde de Miami, Francis Suárez, y yo hablamos con varios doctores de la CDC, incluyendo a la doctora Deborah Birx. Están contentos con lo que hemos hecho para reducir el contagio. Incluso la doctora Birx nos contó que están usando Miami-Dade como ejemplo para otras comunidades en la nación que quieren prevenir el contagio en casas donde viven varias generaciones bajo un mismo techo. Esa es la clave. Todos tenemos que actuar como si tuviéramos el virus. Es importante recordarle a los jóvenes que viven en nuestros condados de tener más cuidado alrededor de las personas de alto riesgo que viven en sus casas. Mantengan sus distancias de sus seres queridos y usan unas máscaras si van a estar cerca de ellos. Me reuní ayer con nuestros distinguidos expertos médicos locales. Muchos de ellos están aquí hoy para contestar sus preguntas. Todos estamos de acuerdo que hay que tomar precauciones para Labor Day en 2 semanas. No queremos ver más contagio como ocurrió después de Memorial Day. Por favor, no tengan fiestas o reuniones familiares. Sé que sueno como un disco rayado, pero tenemos que hacerlo si queremos seguir bajando los números y abrir la economía lo antes posible de una manera segura. Seguimos trabajando con los condados Broward, Monroe y Palm Beach. No queremos dar marcha atrás y ver subir la tasa de infección, más ahora que varios colegios privados y universidades abrieron en la región. Quiero pedirle a los líderes de nuestros colegios que no bajen la guardia y sigan enforzando las reglas de salud pública. El éxito que tengan ustedes será un ejemplo para seguir cuando abran más negocios. La semana que viene comenzaré a reunirme con el grupo de restaurantes y otros negocios. Vamos a planear la futura apertura de estos negocios y hacerlo de una manera donde no tengamos que cerrar otra vez. Cuando el momento sea correcto, vamos a anunciar la fecha para volver a abrir. Como siempre, estas decisiones serán guiadas por nuestros expertos médicos. Ahora quiero hablar brevemente de la tormenta Laura que apunta hacia el sur de la Florida. Tan pronto como el domingo por la noche podemos ver fuertes lluvias y vientos con fuerza de tormenta tropical. Ya tuvimos una práctica reciente con el huracán Isaías. Tuvimos suerte que nos tocó, pero no bajen la guardia. saquen su guía de huracanes el condado Miami-Dade y revísenla. Tengan un plan listo si vive en una zona de evacuación. Si no tiene la guía, le puede descargar visitando miamidade.gov/hurricane. Tengan comida y agua potable en contenedores guardados para al menos de 3 días. Carguen sus teléfonos por adelantado. Limpien sus patios y eliminen escombros. Tenemos un app que se llama Ready Miami-Dade, que todo el mundo debe tener descargado en su teléfono inteligente. Inscríbase para recibir alertas importantes del condado entrando en miamidade.gov. Muchas gracias. And now the doctors and I can take your questions. Patty, what do you have?
Okay, let's do things a little bit differently this time and start with our Spanish-speaking friends. How about that? So let's go to Ana Cuervo, Telemundo 51.
Hello, can you hear me? Yes. Thank you, Mayor. Alcalde, mi pregunta es, el gobernador hace un par de días dijo que ya que estamos bajo 10% de positividad, que ya era quizás hora de sur de la Florida moverse a fase 2. ¿Ha hablado con el gobernador sobre eso? Porque obviamente está hablando de tomar un poco más de tiempo y de hacer las cosas poco a poco. Cuando él dice moverse a fase 2, ¿quiere decir esperar o ya está hablando de que el gobernador cree que ya es hora para nosotros?
El gobernador quiere abrir la mayoría del estado de la Florida lo más pronto posible. Sabe que hablando del sureste del estado de la Florida es un político diferente. Hablé con él ayer, hablé con su oficina antier y no hay nada inconsistente en el mensaje de él y el mensaje mío. Nosotros estamos ahora tomando pasos para empezar a abrir. Tenemos que hablar con los restaurantes, con nuestros expertos médicos, a ver en qué manera podemos abrir esos restaurantes y otros negocios aquí en el condado Miami-Dade. Pero cualquier anuncio sobre apertura y diferentes tipos de apertura va a estar en coordinación con el gobernador. Así que estamos en la misma página.
Gracias, alcalde. Ahora pasamos con Iván Taylor de Noticias 23.
Muchísimas gracias. ¿Qué tal, señor alcalde? Buenas tardes. Quería hacerle una pregunta. Usted en su anuncio dice que la buena noticia es que vamos en el rumbo correcto. En términos prácticos, para que la audiencia entienda, ¿qué significa ir en el rumbo correcto? ¿Existe eso? ¿Significa eso la apertura de algo?
Existe que ahora hay la posibilidad que vamos a abrir, si seguimos en este mismo paso, si seguimos bajando el nivel de contagio, el porcentaje de positivo, los números de personas, pacientes en hospitales. Si seguimos en este rumbo, entonces ahora estamos empezando la planificación para abrir, y especialmente los restaurantes. Muchas personas se están quejando de los restaurantes. Sé que en Broward County están abiertos, así que eso va a ser, yo creo, los primeros negocios que vamos a abrir. Vamos a hablar con ellos y también nuestros médicos el lunes para tomar planificar cómo lo vamos a hacer y cuándo lo vamos a hacer. Pero sí, eso quiere decir que estamos en un rumbo bueno, todo está indicando algo positivo, pero tenemos que seguir con nuestras regulaciones de mantener las máscaras, la distancia y también lavar las manos. Eso es sumamente importante.
Quiere decir que por lo pronto no hay ningún cambio, no hay cambio en las próximas horas. Primero usted tiene que reunirse con el grupo de restaurantes, serían los primeros afectados. Antes de eso, nada cambia.
No, este fin de semana no va a cambiar nada, pero vamos a ver después del lunes cuándo podemos anunciar, si tenemos un día que podemos empezar a abrir los restaurantes. Esto todo, otra vez basado con nuestras conversaciones con ellos, pero también basado en el aviso de nuestros doctores.
Gracias, alcalde. Si algunos de los expertos médicos quería hablar en español sobre ese tema.
Bueno,
Noticias de
Telemundo.
Y quería hablar con la doctora Abo. Adelante.
No, yo creo que el primer mensaje que la comunidad hispana y americana, todos tenemos que entender es, estamos viendo que los casos están disminuyendo el número de hospitalizados. Sin embargo, el número de pacientes que continúan siendo infectados a nivel de la comunidad y en nuestros hospitales y en nuestras terapias intensivas es mayor que el número de pacientes que teníamos cuando reabrimos en mayo. ¿Qué quiere decir esto? Que vamos en camino correcto, pero no estamos todavía tan bien como estamos cuando reabrimos y antes de que viniera este nuevo pico. Por eso es súper importante mantener la vigilancia y aunque sí queremos una reapertura, también hay que esperar a ver qué pasa con la tormenta tropical el lunes. Entonces, hay factores que no están bajo nuestro control, como los huracanes, tenemos que ver qué ocurre y después de eso todos queremos una reapertura económica, pero la comunidad tiene que entender que esto depende de nosotros y de los factores que sí podemos controlar, que es la distancia social, el uso de las máscaras, el lavado de las manos y el evitar seguir infectando a nuestros seres queridos y a nuestro círculo que está alrededor nuestro. Entonces, sumamente importante que la gente siga entendiendo que la pandemia no se ha terminado, que el hecho de que haya una reapertura pronto no quiere decir que ya todos podemos hacer fiestas de nuevo y hay que seguirse cuidando.
Gracias, doctora. Anna, is that good? Are you good with her answers? Anna from 51.
Tengo una pregunta para la doctora. Se había dicho que había que ver una tendencia de menos casos bajo 10% de positividad por 14 días antes de una próxima reapertura. ¿Qué quisiera ver como experta de enfermedades infecciosas? ¿Qué quisiera ver antes de entrar en la fase 2?
Bueno, yo creo que esa es una decisión que tenemos que tomar en conjunto con el Health Department. La decisión no depende de lo que yo quisiera. A mí personalmente me gustaría ver menos del 5% de transmisión para estar con más tranquilidad. Estamos yendo en esa dirección, pero todavía no estamos por debajo del 5%.
Así que el 10% no es suficiente.
Bueno, el 10% es mejor que el 20%, que es en donde estábamos. Entonces vamos a tratar de mantener el optimismo de que vamos a poder llegar a algo mejor, siempre y cuando nos comportemos como debemos.
Gracias, doctora.
Gracias, doctora. Okay, we'll switch over to English now. Doug Hanks, Miami Herald. Out to you.
Thank you. Mayor, can you clarify what role the governor's phase 2 plans play in Miami-Dade? Miami-Dade all affected by that?
Usually what we found with the governor is that he allows Dade, Broward, Palm Beach to have their own rules, and because we're somewhat unique, and so that has not changed. So the governor, there are some things that he may preempt us on, but there's very few things that he preempts us on. He actually allows us to maintain our rules and regulations here because, you know, things are a little bit different down here. That will not change as far as the conversation that I had with him yesterday. We're on the same page, the things that we need to do. I'm on the same page with him that I want to open up our schools as quickly as possible, our business as quickly as possible, but we have to do it in a safe manner.
Thank you.
Thank you, Mayor. Veronica Zaragovia from WLRN. You're up next.
Thank you. Mayor Gimenez, I have a couple questions. One is that Governor DeSantis earlier this week said that he's not sure he's seeing, quote, the bang for the buck from, end quote, from testing, because there are too many 22-year-olds are being tested, but in the county you have more testing this week and open till 8 p.m. So I was wondering, what is your message to the public about the importance of testing to contain the disease?
If you feel that you are ill, or you feel that you may have been in close contact with somebody who has contracted COVID-19, you should get tested. We have plenty of sites open now. Today's with my staff briefing, we have about maybe 50% of the capacity is actually being utilized right now. That's good news, which means that a lot of people feel fine and don't need to get tested. We used to fill up our slots like in 10 minutes, all of our slots would be filled up. Now we've opened all day and we're filling up maybe 60% of the slots. So the message is there's plenty of testing available to you, to the public. Please take advantage of it, especially if you're over 65 years old, and especially if you feel symptoms, please go get tested. It won't take you long. We can even have you the same day take the test because we have that capacity now in Miami-Dade.
Thank you. Just a quick question about the benchmarks for further lifting of restrictions. Is it an ongoing discussion, or is there, say, certain number of days that the positivity rate would be at a certain level, plus other benchmarks that Miami-Dade County would have to meet?
Well, look, there are benchmarks that are in the literature, 14 days below 10%, et cetera, but these are all subject to discussion. And again, what's happening in the community? Are we having fewer and fewer patients going into the hospital? Yes, we are having fewer and fewer patients going to the hospital with COVID-19. But as Dr. Abo said, and all the other doctors, there is an expectation by some of our experts, as a matter of fact, both the national experts and our local experts, that we're going to have a spike again sometime in September or October. And so the lower that we can get this positivity rate now, then the less than that, the lower that wave or that spike will be in September, October, and we never want to get to where we were, a couple of weeks ago. And so again, there's no book on this. This is discussion, and then what are you seeing? What are the trends? Can we open this up, better? Can we open this up, now? What are we seeing? Hey, they have this open in some other community. What have they seen there? So, we're learning as we go, but we're always discussing it, and we have lively discussions on what we should be doing next year in Miami-Dade.
Thank you so much.
Thank you, Mayor. Okay, we will go out to Amy Viteri with Local 10.
Hi, Mayor. How are you? One thing I wanted to see if we could just get a little more specifics on. I know you mentioned restaurants being a priority, seeing what's next for them, meeting with them next week. Are there any other in particular that you're going to be looking at, and what could these changes look like? Are we talking indoor dining? I know you said it's not going to be going back like it was before. And then also, if possible, if I could have Dr. Abo say in English what she said in Spanish, just kind of talking about what this means, where we are right now, saying that the cases we have now are still higher than what we were seeing in May, just to kind of reiterate that in English for our viewers. Thank you.
Sure. And it's the indoor dining issue. That's the issue we're going to be discussing on Monday. Right now, restaurants are open. They can have takeout, they can have delivery, and if they have an outdoor space, those outdoor spaces are open, have been open, they've never closed. It's the indoor dining. That is the issue. Now, the rules are already in place. We already know that. It's 50% capacity, but we need to talk to them. We need to talk to our medical advisors, have a discussion, okay, about when is the appropriate time, where do we need to see in order for us to do that, so that the restaurants themselves can have a pretty good idea of when it is that we'll issue that order. I hope to issue that order as soon as we can, but again, that's up to discussion on Monday. And then Dr. Abo now can repeat what she said in Spanish and English.
Well, quick though, just restaurants. What we're talking about?
No. We're going to be also talking to the casino group. They feel it's unfair that they're closed while we have the Miccosukee Casino open in West Dade. They don't have to follow our guidelines, whereas the casinos under our jurisdiction do, and they want to show us all of the measures that they take in, and that it's safe to do so. So again, I'll be talking to them, and I also believe that the health group wants to talk to me again. So we'll be doing that, and I also want to discuss some things with the hotel group, because we need to discuss also what's going to happen here on Labor Day, and the discussion on beaches. And if we do keep our beaches open, which at this point I have no plans to close them, that I'm going to need help from the hotels to safeguard and to kind of patrol their area of the beach to make sure that we keep social distancing, et cetera, on the beach. It's much safer to be outside than it is inside. And so there's a trade-off here. When you start closing outdoor venues, then people start rushing indoors, and indoors is not where we want them to be. We'd rather have them outdoors than indoors, but we don't want them outdoors congregating in large groups. And so there's a trade-off there. So Dr. Abo, the floor is yours.
Sure. So repeating what I previously said in Spanish, first, this is a call to the whole community. I want to congratulate the people who have been doing the right things. There are some areas that have been leading by example, how they have been managing, social distancing, always wearing the mask, hand hygiene, including many venues. So I think we need to reinforce that. On the other end, the call is to everyone to understand that even though we're heading on the right direction, at some point we were over 20% transmission, now we are 10 or less than 10%. We're still not where we were in May when we started to reopen. We have way more cases than we had back then as a state, as a county, as every one of our cities. And our hospitals have more patients now, including patients in critical condition and very sick, including younger people. So this is not over. The fact that we're looking at reopening will be impacted by what happens this weekend, if we get the storm or not, and how the environment affects everything. So we cannot control hurricanes or the environment, but we can control our behaviors. And everyone should keep their guard up as universities and schools are reopening. And as we're looking to safely have a good and healthy economy, everyone needs to continue wearing their mask and washing this reusable mask, hand hygiene, eye protection, and social distancing. Really, it's really a call for everyone to take care of each other, your close circle, and yourselves.
Patty, may I just add something to Dr. Abel, if I may?
Sure.
So I think all of us, we all sound like a broken record, but whatever these measures that Dr. Abel just went through and the mayor, it is working. So we want to thank the community for adhering to it, because this is going to be our new normal, even when we decide if and when we're going to reopen. It needs to be adhered. At the hospital, I just want to emphasize, our healthcare providers, we have not stopped working. People are exhausted. Our hospitals are very busy. Our ICUs are full. We're still with very sick patients with COVID-19, much higher numbers than were in phase one. We want to thank the community for understanding, and want to ask the community for their support and continue to adhere to those measures.
Thank you so much for that, Dr. Ferreira. Our next reporter with a question is Phil Frazen with NBC6.
Can you hear me okay?
Yes. Go ahead.
Two questions, actually, one for the doctor, one for the mayor. The first one for the doctor, just to follow up on you said certain areas really excelled and did what you all recommended. Can you be more specific and give a shout out to those areas? Like what parts of the community did really well?
Sure. Dr. Marty and Dr. Villalta are also on the call, so I would like them to also speak up. But I can say, for example, hair salons, nail salons, I've seen them like really working extremely well. We've had no cases in the contact tracing reporting to those areas. And those are areas where you have to be in very close contact with the customers. So the fact that they're mandating all the customers to wear their mask and the employees are taking all the precautions, I think that's a great example of how we can do things very well done when we all adhere to the rules. So those are some of the examples, but I'm sure Dr. Villalta and Dr. Marty may have others as they have been doing field trips and looking at the community.
I absolutely agree with you, Dr. Abel. They have been doing a fantastic job. When we're looking at the majority of individuals that are being exposed, or it is definitely through household contact. So we want to make sure that, like the mayor said, that we're adhering to and protecting each other even within our households. Definitely, very few cases from hotels. We've seen the homeless shelters have been doing an excellent job and putting those mitigation efforts when there's a case identified, and definitely with nails and hair salons and so forth.
And I'll just...
Yeah, go ahead, Dr. Martin.
No, I'll just thank you so much. I completely agree with everything that Dr. Abel and Dr. Villalta and Dr. Ferreira have said, and I want to add that so much of this is behavior-driven. It's what we do. If we follow the basic things that we all know to do, as hair salons, for example, have done, as all these places that are doing well have done, we can get this under control. It's harder for some businesses to do it. For example, indoor dining is particularly challenging because people have to take their masks off to consume food. And that's one of the reasons that has been a more difficult business to bring back, indoor dining. But we're going to be looking at it, and we're going to be looking at all the metrics that are relevant. So you talk about percent positivity. We have to be very clear what we mean by the percent positivity, and that's only one indicator of the viral burden. I think it's phenomenal where we are right now. I'm so proud of our community. I'm so proud of the mayor and everyone that I work with for where we've gotten here. But they're absolutely right. We've got to keep the lid on this because we're not done yet. We're far from over.
And then the second question for the mayor, now that you expect there's going to be another increase in September, so this would be kind of the third time we've gone through this. is there going to be an action step that you feel like now that you know and have been through this that we're going to see earlier on, and then on kind of on the flip side, is there an action step that maybe you tried in the first two that you realized wasn't as effective for this third round? What are we going to be seeing when we see that increase go up again?
I think you need to be very clear that we don't have to have another rise. It will rise only if during these holidays and these events people drop their guards and they stop following the rules that we all know prevent transmission.
Mm-hmm.
I don't think I could have said it any better. And that's going to be the message. The message, maybe the first time we didn't drive home the message hard enough that, hey, this is not over, and that you need to continue to, wear the mask, keep the social distance on, because some people decided that it was party time, especially young people, right? So this time, the message has to be, no, it's not party time. It's not time to, have all these gatherings. It's not time to, let down our guard. And if we don't let down our guard, and if we continue to wear our mask and our social distancing and washing our hands, and even in the home, kind of keep a distance, I think Dr. Marty's right. It doesn't necessarily mean we're going to have a second wave. Yeah. If we do the right thing, we're not going to have a second wave. We expect the second wave because we expect some people not to do the right thing. So we got to drive that home.
I think it's the enforcement. Again, universities are taking this very seriously. There is no tolerance for students who are not following the rules, including being expelled. So I do think that as a community, as parents, we need to make sure that our kids, our adolescents, our kids in college are following the guidelines, and we as adults, we're setting the example.
I would like to add that, in addition, it's very important for people to realize that yes, young people in general do better. Yes, young people don't necessarily end up in the hospital. But just yesterday, we reported 2 more cases of Kawasaki in young children here in Miami-Dade. There is still a problem for even young children, and we all have to keep our guard. People of all ages need to follow these guidelines.
But that's a good example for the beaches. That we've been through this ringer a couple times now. That if there was a lot of criticism of young people, and we're still partying on the beach, there's going to be a stronger message to say, hey, even though it's Labor Day, be responsible.
No, actually, yeah, more of that. We're also going to be out in force. Mm-hmm. So the beaches remain open. Again, at this time, I have no plans to close the beach, all right, after speaking to the doctors. But our enforcement arm has to, be effective. And that's why I'm going to have one of these Zoom conferences with the hotel industry, especially the ones that are on the beach, to ask their help to make sure that even on their stretch of beach, yes, we're going to have enforcement personnel, but they also need to make sure that, the rules are enforced because, look, keeping the beaches open is important for the hotels, obviously, right, for economic reasons. But, we must make sure that the rules are followed. That way we don't have a surge of cases that we'll see, 14 to 21 days later. That's the last thing we want.
Phil, if I may just add one thing, it's all in the behaviors and in the adherence of the behaviors. I think we can safely do things if people understand that this cultural change that is around is going to be here for a long time. But one thing that we discussed yesterday in our call with the mayor is also the call to vaccinate for influenza, because flu season is starting next month, and it's critical because it's also the same mode of transmission, person to person. It's very important that we protect our population as well. Dr. Abo and Dr. Marty, I don't know if you want to add a little bit more on the influenza.
Absolutely. I think we have been advocating throughout the county that this is extremely important. I feel that we should be providing free influenza vaccine to everyone as much as we can. But those people who have health insurance, they definitely need to get it through their insurance. Children as early as 3 months of age can be vaccinated. This is extremely, extremely important. We're hoping not to have a bad flu season. We know the flu vaccine works. It's not 100% effective, but it works, and it prevents mortalities and it prevents critical illness. We don't want to collapse the health system with a mix of flu, hurricanes, and COVID. That's the perfect combination for tragedy, and we can do something about it. So we cannot prevent the hurricanes, but we can prevent the flu. We can have an easy flu season, and if we continue to take the measures we need with COVID, we can flatten the curve and lower it like other states have successfully done it.
And remember, when you get that flu vaccine, you're helping yourself in many, many ways. It not only reduces flu.
Thank you, doctors. Okay, Andy Slater, up to you now.
Thank you, Patty. Mayor, when you and I spoke on Monday, you said you were going to look at the trends, the numbers, see if everything continued to improve, and it looks like it has. So when it comes to fans at Hard Rock Stadium, what decision are you going to make? And if you haven't made one yet, do you have a better expectation of what it will be?
We expected to make some announcements about Hard Rock Stadium, next week. I toured it, very impressed. Okay, but the things that they were doing, and really a lot of it depends on the positivity rate and then our hospitalization rate. But the things they're doing at the Hard Rock Stadium are very impressive, and I think they're the first sports facility in the world to receive a certified rating on disinfection and all that. So it's very impressive what they're doing. So hopefully we can make some kind of announcement, maybe as early as next week, about what they can and cannot do at the Hard Rock Stadium.
If the numbers stay like they are now or continue to improve, what percentage of capacity will you allow?
Again, we expect to make some kind of announcement next week. We'll make that decision next week. So, stay tuned.
Can you say that the decision has been made, but you're just not announcing it yet?
I can say that we're going to make an announcement sometime next week, and you need to say stay tuned. Okay?
All right, I'll stay tuned. Thank you.
Thank you, Mayor. Daniel Chang.
You want to ask the same question in a different way? Maybe you get a different answer, Andy, or okay. All right.
Hey, Daniel from the Miami Herald, go ahead.
Hi, thank you for taking my question, Mayor. And possibly Dr. Villalta might be helpful here too. I wanted to ask about contact tracing and what you're seeing in terms of the results of the stepped up contact tracing efforts in Miami-Dade. And earlier there was talk about hair salons and I think hotels, Dr. Villalta said, were also low. Is there a ranking now? I remember the mayor saying at one point that many cases, if not most, were being transmitted in the home. I think the workplace was also high. Can you give us some insights into what you're seeing from contact tracing?
Well, I'll let Dr. Villalta, who has all the data, answer that. But yes, she tells us, the percentage of. So she has a ranking of where the contact tracers have found that contagion is actually happening. So Dr. Villalta.
Thank you, Mayor. Yes, it's still the same three that we've been seeing historically throughout, which is individuals in household contact, followed by they don't know where they got exposed, and then the healthcare always seems to fall in third place. So between first and second place, it's always between household and they don't know where they got exposed. So that's what we're really seeing. We have been seeing, fortunately, we have been getting a lot of support. We've ramped up our contact tracing. We have currently 627 contact tracers on board, which is a great improvement from what we had back in June. We have the staff who are able to go through the cases, but what we're asking the community for is really the assistance of them participating through the contact tracing and accepting to follow through the contact tracing to give us the information for us to be able to identify the close contact, reach out to them in a timely fashion so that we can further spread the virus within our community. So that's where we're asking the help of the community. Department does not ask for, as rightfully so, there's a concern with fraud and a lot of scams that we see. But the health department, we do have to verify the identity of the individual. So we will be asking for information such as name, date of birth, and confirmation of address. But in terms of other information, of financial information or anything like that, we will not be doing any questions regarding that. So we really are asking the community for the help. Be able to when you're reached out by a case investigator to please participate in the case investigation and the contact tracing process, which would further help our community.
Thank you so much, Dr. Villalta. Okay, and we have one last question, and this one is from Patricia Mazzei with the New York Times. Hi, Patty.
Hi, Mayor. Thanks for the presser. I wanted to know more. You said the city of Miami is doing well in enforcement. I'm sort of wondering what areas of town you think are still seeing the virus be really stubborn, and maybe one of the doctors, or Ms. Villalta, wants to weigh in on this. So not just that it's household spread, but is it in a particular area of town? Is it, people in a specific industry? Where are the places where it's still stubborn and might just take a little longer to bring down the virus?
Hey, Dr. Villalta.
Yes. So historically, in the past, since March, we've been seeing in the same areas in the city of Miami, Hialeah, and then about in June, we saw hotspots appearing down in South Dade. That seems to have come down, but historically, we can see consistency within those two areas. It's just that we're looking at if there's multi-generational individuals within the home, it's more a condensed population. That factors attribute to that. And we're looking at, for example, in the last 24 to 48 hours, I look at the number of new cases within specific zip codes, although that data does vary a little bit just when we go through the whole verification process of cases to confirm that the information that we have is correct. Do look at we're trying to work and develop a census tract mapping so that we can make sure that we're targeting those specific areas. And you're also, and just to add, when you have, for example, a lot of, back a couple months ago, when you have a lot of ALFs concentrated in one area, that too will increase the number of cases within that particular area when you're looking at it at a geographic standpoint.
Okay, Phil had a follow-up question regarding contact tracing. Phil, you there?
Yep. Can you hear me okay?
Yeah, go ahead.
It's a question kind of stemming from my personal experience. I had COVID a couple weeks ago, and when I got tested at the Hard Rock, the kind of government-run ones, I got a call back from a contact tracer within, I think it was 2 days after the positive. It was really quick. When I went to the private doctors to get tested, I didn't get any callback from contact tracers. Is that something that you are seeing? Is that a common experience? And two, is it people are going to get their tests wherever they want to get their tests, but is it easier from your end if people go to the government ones, the big Hard Rock or Marlins or anything like that?
Not necessarily. The process shouldn't be any different from a government to a private. Their privates are mandated by law. They have to report their results to the health department. But we also have to look at, which is an affecting factor, is the lab turnaround time. So if which we have seen improvement upon. So it's all depending on when you took that other test. And unfortunately, maybe during that time, there was a lag in a delay in lab reporting time in comparison to another time. And I know that the state has been doing and the county been working with the various labs to ensure that we improve the lab turnaround time, which we have seen. Today's data, we can see from those labs that were reported, we had over 80% of those were reported within 0 to 3 days, which is a great improvement. And the overall goal for contact tracing is for us to be able to, once we receive a case, that we reach out to that individual between 24 to no more than 48 hours.
Thank you, Dr. Villalta. And Dr. Marty, Ana Curvo from Telemundo 51 has a question for you in Spanish. Ana?
Hola, doctora. Mi pregunta es, dijo que hay otros factores importantes, además de la positividad, para considerar próximas reaperturas. ¿Cuáles son algunos de esos otros factores que el público debe también estar monitoreando?
Bueno, lo que estamos muchas de las cosas lo estamos platicando ya. Por ejemplo, el número de casos admitidos en los hospitales, los números de casos específicamente en los UCIs y las personas en ventiladores. Y ahora, por supuesto, tenemos casos que de vez en cuando lo mandamos a casa, están bastante bien y se empeoran de nuevo y tenemos que admitirlos de nuevo. Entonces, el caso total que nos da una indicación de la verdad, de lo que está pasando en la comunidad. Entonces, y también tenemos que estar en cuenta qué tipo de examen se utilizó para la prueba, para ver si es una de los métodos que da la información más correcta y saber exactamente qué es lo que está pasando. Dos cosas muy importantes es el métrico de qué rapidez podemos dar los resultados de los exámenes. Por ejemplo, si podemos hacerlo en menos de 24 horas, saber que una persona está positiva, inmediatamente mandarlo a hacer el rastro de casos, eso es sumamente importante. Y eso también se ve que hemos mejorado enormemente en las últimas 2 semanas en esa capacidad de hacer más pruebas, tener las pruebas más fáciles para personas adquirirlas y dar los resultados lo más pronto posible y después el rastro de casos lo más pronto posible. Todos esos métricos son sumamente importantes.
Gracias, doctora.
Gracias. Ben from the Herald has his hand up, so I'll take one more question. Go ahead, Ben.
Hey, thank you. Thanks for taking my question. So yeah, it's just one follow-up on contact tracing. We spoke to someone who's working on a lot of Miami-Dade cases through the Maximus contract through the state, and they said that there's that only the case investigators have the ability to notify people of a positive result, and there's obviously triple the number of contact tracers versus case investigators. And what this person described was that they're sitting around refreshing and not able to trace any contacts because there's nothing there for them to trace. Has that been brought up to anyone, or are you aware of that issue, and is there anything done to address that?
I will reach out with the Maximus contract to find out. But we do have those at the local level and at the state level through Maximus, case investigators and contact tracers. But I will look into that.
Okay, thank you so much.
Thank you.
That will do it, unless anyone has any questions about the potential storm that we are still in the terrible cone of. Anybody have any storm questions? No? Okay. So that'll do it. If you guys want to hang out and listen to Yvonne Morisot, he will be presenting the storm's message, the mayor's storm message in Haitian Creole up next. Other than that, Mayor, if you wanted to say anything else before we leave?
No, thanks, Patty. Again, the message, and I think the message you heard all of our medical advisors and our medical experts, drum in over and over again, is that it's all up to us. All right, it's our responsibility. We have to keep wearing our masks, keep social distancing, wash our hands, and then in the home, multi-generational homes. Hey, if you're venturing outside, you may have caught the virus. You may want to stay away as much as possible from those that are high risk. And so, that's the message. When we start to open up, that'll continue to be the message. We're going to be in this new normal for quite some time. So wearing the masks and social distancing, not only is it good for COVID-19, it's also good to tamp down the flu. And then please, everybody that can, get a flu shot. That'll help our doctors. That'll help our hospitals so that we don't have a double whammy of a heavy flu season and a COVID-19. That would really be devastating to our medical system. So get a flu shot. Good news, though, I hear is also the CDC told me that they're going to be buying more flu shots that will be distributed freely across the nation, probably to the order of 10 times more, 20 times more the number of flu shots that will be free to the public, and they've ordered hundreds of millions of flu shots. So we all need to take it to prevent the flu. We need to wear our masks, social distancing, wash our hands to prevent not only COVID-19 but also the flu. So with that, thank you all. Have a great weekend. Hopefully we won't have a storm coming our way. Hopefully it dissipates. But if we do, we'll keep you posted. Thank you. God bless you all.
Thank you, Mayor. Now out to Yvonne Morisseau with the storm message and message. Can't get that word out today in Haitian Creole. Yvonne, go ahead, please.
Bonsoir tout le monde. Et Kounia, on a pris un petit temps pour nous parler de trompette tropicale Laura, qui a avancé rapidement sur Floride. Il y a un potentiel pour venir avec un pile la pluie, vent avec à travers toute cette Floride là. Puis bonnet dimanche dans la nuit ou bien lundi matin. Gagner un petit temps qui a traversé dans cette Floride là, mais ça va gagner pas gagner pour louer avec des trompettes tropicales ou bien dépression tropicale 13 là. Comme ça, tout le monde t'a dû préparer Kounia. Yo t'a dû tout. Nous déjà fait tout exercice. Nous quelques que nous sommes fait là. Nous déjà fait un exercice dans la fin de semaine là avec cyclone Isias. Nous t'es épargné, mais tant pis. Fais un pile prudence. Rale guide préparation cyclone Contéa te recevoir que nous te recevoir dans mes Contéa dans la poste dans commencement année ça. Faut gagner un plan détaillé et puis checker si ou pas vivre dans une zone d'évacuation. Ou qu'à télécharger guide là dans miamidade.gov/cyclone ou bien miamidade.gov/hurricane. Conservez manger à l'eau dans récipient sous main pour au moins 3 jours. Charger téléphone si qu'il est d'avance. Assurer que vous gain pile et puis tout nettoyer débris dans la cour. Nous gain tout yon app gratis qui relè Pare Miami-Dade que tout le monde t'a dû déjà gagner sous téléphone intelligent yo. Mais si vous pouvez faire ça, tant pis inscrit pour alerte Miami-Dade là dans miamidade.gov. Merci que bon Dieu bénisse à compter à Miami-Dade là. Songez, restez pi en sécurité dans Kaila. Merci.
Thank you very much, and thank you everyone for joining us this afternoon. Have a great weekend.